Hi, my name's Phil. I like talking about politics, and in this video I'd like to set out the severe crisis in the NHS. Which one, Phil? Good question. There are so many. In this case, nursing numbers. Essentially, the latest information is showing we have a huge shortage of nurses and a government which is trying to make it harder to recruit nurses from abroad, but also training fewer nurses, way fewer nurses, from the UK as well. Doesn't sound like it adds up, does it? But it does add up to an NHS close to collapse, just what the Conservatives have wanted for decades. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel. So I'm going to go through this as simply as I can with incredibly stark facts and figures. The first figure is our current position. As of last month, the NHS was short of 40,100 nurses. The NHS has a general staffing shortage of significantly over 100,000, but I'll focus on nurses here. So we're short of just over 40,000. We need to bring in more nurses each year than we are losing. And more than that, because the shortages are so large, we need to bring in a lot more nurses each year than we lose. So a bit of context for those shortages. As of February this year, we had 358,818 nurses working in the NHS. So that 40,000 shortage represents 10% of the necessary nursing workforce being missing. 1 out of every 10 nurses that the government says the NHS needs is not there. That's how bad the shortage is. In 2022, we had 40,365 nurses leave the NHS. Now, various reasons for this. Retirement is an obvious one. That'll happen every year. But also poor pay and unreasonable working conditions caused by the fact that the lack of resources under this Tory government has pushed some of our nurses beyond their limits. That's why the numbers leaving nursing are at record highs. So we have a shortage of about 40,000 nurses and about 40,000 nurses leaving the NHS in a year. And that is not set to improve because the pay in real terms is even worse now. So we need to recruit, big start. 2 obvious sources of recruitment: immigration and training. It's well known that our NHS relies upon foreign medics, with 1 out of every 6 NHS workers coming from outside the UK. But we also have a government which has, since Brexit, made it more difficult to recruit foreign medics, including nurses. In reality, they have had to assign NHS roles to shortage occupations to get around this, hence the drop in the number of nurses from Europe, but the increase in the nurses from Africa and Asia. But the government nonetheless have a formal policy of wanting to reduce immigration, despite the fact it's increasing. And so that surely means training must be their preferred source of recruits. Now, before I get onto the latest worrying news regarding training, let's look at some background. When the Tories came to power in 2010, the number of student nurses accepting places at university had just fallen. And then it immediately fell further with the Tories in office. It took until 2014 to get back to those 2010 levels. After which it potted around the 22 to 23,000 level for a few years. Although bear in mind, because the population was growing over that period, per capita that actually represented what looked like stable levels actually represented real terms cuts to student numbers. Then it looked like the Conservatives were taking things slightly seriously, and we had a huge surge in new student nurses. Nearly 30,000 in 2020. And you think, well, this is more like it. That represented, per capita, 443 new student nurses per million of the population. Now, that's way higher than the 346 per million in 2010. I mean, that we might make headway after all. Now, bear in mind that student nurses, when qualifying, won't all go and work in the NHS, of course. But nonetheless, the huge boost to student nurses was still very welcome news. Unfortunately, the government massively dropped the ball under Boris Johnson. The Prime Minister, who boasted about getting serious about nursing shortages, has now left us in a position whereby the latest report says that only 15,420 new student nurses have taken up a place this year. I want to point something else out before I go on as well. So at the moment, the government are boasting about the record numbers of nurses entering the NHS. That is very likely because in 2020, we had a huge surge in the number of new student nurses. It takes a few years to train, but it has since dropped off. So that record injection of nurses into the NHS, doesn't matter who wins the next election, cannot possibly continue over the next few years. It's really that simple. But anyway, 15,420 new student nurses taking up a place this year. That's about half of what it was when Johnson had just become Prime Minister. It's also a huge reduction in the number when compared with the Tories took office. So it's like their worst ever by far. It's like they had 1 year, 2020, when things were looking up, and then that was that. Remember, I said we had 346 new student nurses per million of the population in 2010, then 443 in 2020. This year it's 228. And it's not like this year's a blip. It was bad last year as well. Whatever caused the Tories to decide that actually it was in their interest to genuinely boost student nurse numbers in 2020, as opposed to just talking about it, seemed to evaporate when Johnson took over. For what reason, I do not know. Maybe his lack of attention to detail. Maybe the pandemic confused them. Although how a serious pandemic shifts your focus away from healthcare staffing, I do not know. Surely it should focus attention on it. But for whatever reason, the situation is worse than ever. And because it takes several years of training before you even get a bottom of the scale inexperienced nurse, these figures are going to be problems for the next Labour government as well, come what may. Like I said, doesn't matter who wins the next election. The record numbers they're boasting about at the moment, that was the result of that 1 year when they boosted student nurse numbers. That's gone. Their only option, Labour's only option for the first Parliament, will be to address the problem with immigration. That is it. Even if Labour immediately boosts the number of student nurses back up to 2020 levels, or even better, will not be until the following Parliament before we see the benefit. And that's just in terms of raw numbers. In terms of experienced nurses, this Tory failure has knackered us for a generation. We have a huge shortage right now. We have record numbers of nurses leaving the NHS because of poor conditions or pay or both. We now have nurses entering training being lower than at any time, even under this Tory government. And we have a government who have deemed it sensible to put barriers in the way of recruiting from abroad, not just uncompetitive pay, but Brexit red tape. Whatever changed since 2020, the Tories have now clearly decided that destaffing the NHS is the best way to bring it down. In much the same way that our immigration minister recently said that the out-of-control asylum backlog is a good thing, politically. Clearly our health secretary, although he's not saying it publicly, he's maybe not that stupid, he clearly sees huge shortages and low numbers of trainees as a good thing as well. But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.